Welcome to the CaladriusHealth channel. I'm so glad you're here for the second episode in our ABDM series. Today, we're taking a really focused look at the patient perspective of ABHA. In our previous explainer, we talked about the structural data fragmentation that the Ayushman Bharat digital mission was designed to fix. But today, we're shifting our lens to the human element. We're going to explore exactly what this digital architecture means in practice, right at the hospital registration desk, and inside that crucial patient-provider relationship. We'll keep things calm, clear, and focused purely on the facts of how the system works for you. So here's our roadmap for today. We'll start with the ABHA reality check, break down the difference between an EMR and an EHR, and walk through the physical registration desk experience. Then we'll clear up some common misconceptions, address the awareness gap, and finally look at the road ahead. Section 1. The ABHA reality check, registration scale versus real understanding. Now, as of March 2026, we are looking at 86.64 crore ABHA registrations. That's a massive number, right? It literally places India's digital health ID among the largest citizen-facing programs in the world. But here's the thing. Having a number and actively using it are two very different things. The conversation about what this number actually means for patients in their day-to-day healthcare journeys is honestly just getting started. Okay, let's start with a foundational definition because this clears up so much confusion right out of the gate. An Ayushman Bharat Health Account, or ABHA, is a permanent, unique health identity number. The absolute crucial point here is this. ABHA is an identity address, not a file cabinet. It acts as a consent-based pointer to your health records across different providers. It is strictly not a centralized repository where all your medical data is stored by the government. Your records stay exactly where they were created. ABHA just gives you a secure way to point to them. Section 2. EMR versus EHR explained. Where your data actually lives. To really get how ABHA works, we first need to understand the critical difference between an electronic medical record and an electronic health record. Think of an electronic medical record, or EMR, as a single facility's record of your care. It lives securely at the hospital that created it. ABHA actually does nothing to this record. It exists with or without your ID. Now, an electronic health record, or EHR, via ABHA, that's a linked view of your records across multiple providers. The actual data still lives at those originating facilities. ABHA simply holds the pointer to that data, allowing you to link, share, and importantly, revoke access through your own explicit consent. Section 3. The registration desk experience, the physical impact of digital health. Let's take abstract digital concepts like ABDM and NHCX and anchor them to a highly relatable physical location, the outpatient department registration counter. Just picture this scenario. Think about the difference when you arrive with a linked ABHA. You walk into an integrated facility, scan a QR code, and registration happens in seconds. Your physician already has prior clinical context because you've consented to share past records, and you are in total control of that access. Contrast that with the traditional way. Manual entry from scratch, relying entirely on physical documents you hopefully remember to bring, and having to verbally reconstruct your medical history. Both are totally valid ways to receive care, but the digital path removes a significant amount of friction. And speaking of removing friction, here is a highly tangible benefit. 76%. That is the reduction in average OPD queue time observed in integrated public hospitals using the scan and share function. We're talking about wait times dropping from 30 to 40 minutes down to just 5 to 10 minutes. When you're feeling unwell and just standing in a crowded hospital lobby, that time reduction is a massive immediate improvement to your experience. Section 4. Clearing common misconceptions, fact-checking patient beliefs. Any system of this scale naturally generates misunderstandings, so let's clarify the actual rules of the road for you as a patient. We're going to tackle 4 specific myths today. First, that ABHA stores your health records. Second, that ABHA is mandatory for treatment. Third, that the system automatically pulls all your prior records from everywhere. And fourth, that simply creating an ABHA number is the same thing as actively using it. Let's start by busting myths 1 and 2. Like we said earlier, ABHA is a pointer, not a repository. Your data stays with your doctor. But more importantly, ABDM is entirely voluntary. The National Medical Commission has issued very clear directives that while hospitals should integrate and offer this system, care must never, ever be made conditional on having an ABHA ID. Hospitals absolutely cannot deny you treatment if you choose not to register. You're always in the driver's seat when it comes to participating. Moving on to myths 3 and 4. Look, ABHA does not magically pull all your past medical history out of thin air. It only links records from facilities that are already part of the integrated ABDM network, and only if you actually consented to link them during your visit. So, if you visited a small, non-network private clinic 3 years ago, those records won't automatically appear. And finally, just creating an account online doesn't give you the benefits. To actually deliver value, your ABHA number must be physically or digitally presented at the hospital registration desk when you go in for care. Section 5. The Awareness Gap, Bridging Registration and Meaningful Use. So why is active understanding of the system currently lagging behind those massive 86 crore registration numbers we saw earlier? Take a look at this. A 2025 study at Ames Guwahati, which is a tertiary academic medical center where digital literacy is generally higher than average, found that only 35% of surveyed patients were actually aware of ABHA. 65% were completely unaware. This highlights a really critical, urgent need for ongoing patient education. You can build the best digital roads in the world, but if people don't know where they lead, they aren't going to drive on them. We also have to talk about the digital divide. Urban internet teledensity sits at over 110%, while rural teledensity is around 45%. So the awareness gap naturally widens in rural contexts. And this is exactly why the Ministry of Health and Family Welfare provides assisted and offline modes for ABHA creation. The system is designed to be inclusive, ensuring that hardware or internet limitations don't prevent someone from securing their digital health identity. To fix this gap, the conversation at the hospital is everything. This quote perfectly captures the ideal, empowering conversation that should happen at every single registration desk. Your ABHA number is your health identity, not a file. You decide who sees your records, what they can see, and for how long. When hospital patient experience teams clearly communicate this, patients leave feeling secure, informed, and ready to use their digital identity effectively. Section 6. The Road Ahead. The Human Layer of Digital Infrastructure. Let's wrap up by looking at how the value of this entire system will compound over time. The digital foundation is built, right? But the ultimate success of ABDM really comes down to 3 human factors: patient awareness at the point of creation, staff readiness to explain consent, and consistent use at the registration desk. It's this human layer that transforms a digital initiative into a truly transformative healthcare experience. The infrastructure is ready, but are we as patients ready to take control of our health identity? In the next episode, we explore the Health Facility Registry and Healthcare Professionals Registry, the trust layer behind ABDM integration. Thank you for watching CaladriusHealth.